of my LinkedIn connections, Emily Powell, has asked a question about the difference between a general registration pathway and a clinical registration pathway in psychology. Her question says, I'm currently a fourth year student aiming for clinical. I'm just wondering how exactly clinical differs from general in a psychologist career. She asks, from my understanding, they may work with more complex cases and can undertake research. Is this correct, and is there anything else? It's a great question because in actual fact, this kind of comes up, I think, quite regularly in psychology, and in actual fact, there's been lots of controversy around a two-tier position in how psychologists are paid when they're clinical or when they're registered. But Emily's not asking about, from the Medicare perspective, she's asking about, career. Look, in many ways, there are lots of similarities between the two, and in some ways there might be some differences. And this is a little bit controversial because not everyone's going to agree. But the difference is, in a general registration, there is 4 years of university, being the undergraduate, and then we'll see, whether it be some type of postgrad. Now that'll be either an honours or it might be like a grad diploma. So there's a 3-year undergrad, a year of postgrad or honours, and then you go out and do what we call a +2, for example. It's probably the most common. There is a +5. I'm actually not very well, +1, so 5 + 1. I'm not very well versed on that one, so I'll just talk about this for the moment. So the +2 means that someone goes out and effectively goes out and completes, an internship, so to speak. So this is where you do on-the-job training, on-the-job work. You're more often than not asked to find your own placement or role position where you go out and undergo further training. The idea here is that you're allocated a supervisor, or you find yourself a primary supervisor and a secondary supervisor, and through 2 years you're asked to go out and meet particular competencies. So there is 4 years of very specific criteria-based learning, and then the 2 years is really about the supervisor and your own sort of work about meeting particular competencies. Now there's also some case plans that you need to go out and write up, and a number of other things, along with, at the end of all of this, sitting the final exam. So that's one pathway. Does it mean that you can't see complex cases? Absolutely not. I think any psychologist can see, highly complex cases. It's really about one's competency, about one's experience. I don't believe that anywhere there is a position where it says only a clinical psychologist can go out and treat a particular person. In actual fact, a client willing to see a psychologist, whether they're registered or clinical, is what this is about. Two people coming together, a professional who's trained in psychology and someone who's going through hardship and difficulties. The master's program, or the clinical, spans the whole time through formal training. Now, I'm not suggesting that this is informal, but it varies between, the supervision here varies between each student quite a lot, because supervision with one psychologist versus another, depending on how much experience there is, versus a very specific criteria that needs to be ticked. I mean, that's the curriculum. Right? And so here we've got a 3 plus a 1 and then a 2 years of masters. And after that, if it's a master of clinical psychology, you go out and complete that, and you can go for registration or apply for registration. The controversy here is not only in the Medicare tier, 2-tier framework, but it's also in, there's I suppose, argument that one is more trained than the other. And look, in some sense, I'd have to agree with some of that. And how do I agree with that? Well, I would say there is 6 years of university, and by the curriculum of what university is teaching, What that means is that someone is formally going through a whole series of topics, no different to the first 4 years. This is just an extension of that. The master's obviously more advanced learning, and so it's formalised. So there's 6 years of uni versus 4 years of uni. Does that go out and translate to one person or one, does it translate to registered psychologists being less competent than their clinical counterparts? Look, I don't know, but what I can comfortably say is I think the more training someone gets, the more likely that they're going to have a great grip on what psychology is, how to go out and provide that therapy and that support and the like. I mean, this is why professional development is highly important. The only difference here is with professional development, it's not formalised. There isn't a particular curriculum to go out and cover. From a research perspective, hey, look, I actually think that once again, both psychologists can go out and do so. Obviously, a master's student has often done, has gone out and completed a thesis. So they've gone and partook in quite an extensive study of whatever it was that their topic was about, and an interest, and found out more about research methodology and actually how to physically go out and do that. Here with the +2, 4+2 program, I don't believe that the pieces of writing reports are as extensive as the thesis, and obviously don't require it to be evidence-based piece where we use data and statistics and basically look at writing an article with the possibility of publishing afterwards. So I don't think there's any restrictions, whether you do the 4+2 or the clinical masters as to practicing psychology. There is a difference in the two-tier Medicare rebate for clients, but as to whether there's competency in both, the APS, AHPRA both recognise that there's perfect competency in both. There is that understanding that there's a couple extra years of university in a year. And look, that's under debate as to whether that actually means anything about competency, and whether there should be equal Medicare tiered program. But I'd love to hear your views and see what you think. I hope for those out there who are in the student process looking to come on board, to go either go out and do the clinical program or the 4+2 general registration program. All the best with your studies. I hope that helps a little bit, but get in there and do it, because we definitely need more psychologists here. Hey there, you probably thought that was the end of the video. So did I. After I posted the video, it came to my attention, thank you for the viewers who made comments, that I didn't actually complete the whole equation. So let me go back a little bit and clarify. With the 4+2 pathway, there's obviously 4 years of curriculum-based learning at university and 2 years of additional supervision before someone can apply for general registration. With the master's pathway, Masters of Applied Clinical Psychology, a student goes and completes 6 years of curriculum-based university learning. And at that point, they can also apply for general registration to become a psychologist. So at this point, both pathways allow us to go out and apply for general registration. The difference, however, if someone would like to progress on and, apply for clinical endorsement, is the master's pathway allows you to do so, and the 4+2 pathway doesn't. So if you completed a master's program, 6 years of curriculum-based learning, you're able to then, with the aid of a supervisor, and it needs to be an AHPRA endorsed supervisor, with 2 additional years of experience and practice and supervision, something similar, but certainly not the same as the +2 program here, but additional 2 more years. After you've completed that, meaning a total of 8 years, you can apply for endorsement from the clinical college. And if you're accepted in that, you're able to call yourself a clinical psychologist at that time. So even if you complete a Masters of Clinical Psychology and do the 6 years, you're still only registered on a general basis or have general registration. It requires 2 additional years to go out and get that endorsement. So that's the difference there with the 2-tier position as well, is that someone requires 8 years versus 6 years, and it's only masters, it's only students who have completed masters level curriculum based learning that are able to apply for that. Now, the good news is, even if you've gone out and completed your 4+2, if it's something that you choose to do, you can apply to do the master's program as well. I know it's a very hard pill to swallow, and that would be very difficult. You know, there's HECS fees that goes along with it. There's another, a couple of years of training to do the masters. It's highly competitive, and this is where some of that controversy comes from. But I hope that's clarified what I missed, and thank you as well for your patience in waiting for this little bonus footage to come out to clarify things.